just to kind of get started on this subject, how is gestational diabetes diagnosed?
Yeah, it's a good place to start. So, gestational diabetes is a type of diabetes that we only first find in pregnancy, right? Some people may come into pregnancy with pre existing prediabetes or type 2 or type 1 diabetes, and I'll just keep calling it GDM because it's
Mhm.
gestational diabetes is a mouthful. But GDM is first diagnosed around that 26 to 28-week mark in your pregnancy. And that's really because it's the time when your placenta starts to make all of these hormones that is making mom really resistant to the action of her own insulin, which is that blood sugar lowering hormone. So it's around that time that we diagnose it.
Okay. And so how can a mom reduce her risk for gestational diabetes? Is this something that would start before they're pregnant or, in the beginning stages of pregnancy? Are there different things to do at different times?
Yeah, so GDM really is just at that time point at 26 to 28 weeks mark. But I think it's definitely to your benefit to maybe know what's your blood sugar level going into your pregnancy, maybe even before you conceive or sometime in that first trimester, just so that we can get a look to see if we're perhaps missing anything. There are certain risk factors that might predispose someone to getting gestational diabetes. Some of those we can't change, right? Like our age, our race and ethnicity, our family history of diabetes. So someone might get GDM just based off of that. But, certainly prior to pregnancy, making sure that we're at a healthy weight, that we're trying to eat a well balanced diet and move our body, doing that prior to pregnancy and as best we can during the first and second trimesters could potentially help to decrease your risk of developing GDM at that point.